assess the Babinski reflex, so striking the outer edge of the foot. And the baby should have a positive Babinski sign if the toes and feet flare out as well. I will also check the step-in rotate by putting the baby in an holding position upright, and the feet should touch on the flat surface, which responds to the stepping motions, which indicates that they have a positive step-in motion, which is also an expected finding in the newborn. So I also can assess for the capillary refills in the sternum area. So I know that in a regular client, in an older client, we would assess the nail bed, but with the newborn, we'll assess the sternum. So press down for about 5 seconds and put my hand up, and then the color should come back within 3 seconds or less. I can also assess the brachial pulse, which is under the baby's arms, and making sure that they're equal on both sides. I can also auscultate the lung sounds, making sure that the lung sounds are equal and there's no labored breathing. I would also assess the newborn's lung sounds for a full minute. And also I did talk about listening to the bowel sounds and making sure that the abdomen is round, shape, and normal, and also that the baby's having diaphragmatic breathing and there's no retractions in the abdomen. I also talked about assessing the umbilical cord, making sure that, you know, if it has fallen off, that it is fallen off and it's healed well, it is dry, and that there's no redness or unusual discharge. I can also check the femoral pulses when I looked at the genitalia area, which is in the groin area, making sure that it's equal and strong. And I also assess the full range of motion in the legs and the feet. And that's about it. So that will be the newborn assessment, head to toe assessment. So I also indicated that there was good lighting when I was doing this assessment, that the newborn was calm. If the baby isn't calm for any reason, I will make sure that the mother is in an area where she can support as well and be supportive of the baby. And if the baby isn't calm, I'll make sure that it has a pacifier. If the baby is swaddled, I would also make sure that I expose a certain area, not at once, but at the separate time of the newborn assessment, and also starting, like I said, from the least invasive to the most invasive, so that the baby remains calm during the whole evaluation. And that's about it. If I was also assessing the vital signs, I would be doing that as well in the beginning with the APGAR score. I will also measure, like I said, the length of the baby, which should be within 45 to 55 centimeters, which indicates 18 to 22 inches. Like I assessed the head circumference, which I said was 32 to 36 centimeters, which is also 12.6 to 14.5 inches. I'd also assess the chest from the back of the baby's back to above the nipple, making sure that the chest circumference is within 30 to 33 centimeters, which is also 12 to 13 inches. So also want to make sure that we have the tape measure, which is very important as well. Making sure that the baby's when I'm listening, auscultating to the lung sounds, making sure that the respiratory rate is within 30 to 60 breaths per minute with short periods of apnea that is less than 15 seconds. I want to also make sure that I don't assess any apnea that is longer than 15 seconds. I would definitely notify the healthcare provider if so. If the baby has any crackles or wheezing, this could indicate signs of infection in the lungs. I will also know that if the baby is grunting or the nose is flaring, this is a normal indication of, this is a clinical indication of respiratory distress. Also, when I'm auscultating the heart sounds, I want to make sure that it ranges from 110 to 160 minutes. I want to assess the apical pulse for 1 full minute, like I said, especially when the baby is preferable when the baby is sleeping to do that. And I would auscultate the heart rate from, I would place the stethoscope, the pediatric stethoscope, on the 4th or 5th intercostal space at the left mid-clavicular line above the apex of the newborn's heart, and I'm assessing for any heart murmurs, and I will document and report that as well. If I'm assessing the baby's blood pressure using a small blood pressure cuff, a baby's blood pressure cuff, I would use a pediatric baby's blood pressure cuff, and I would want to make sure that the systolic blood pressure ranges within 60 to 80, from 60 to 80, and making sure that the diastolic ranges from 40 to 50. And I would do an axillary temperature under the baby's armpits, and making sure that the normal ranges are from 97.7 Fahrenheit to 95.5 Fahrenheit, which is also 36.5 to 37.5 Celsius. So I want to be making sure that the baby's not at risk for any hypothermia or hypothermia until we're assessing for thermoregulation as well. Making sure that the baby is covered, especially when the baby first comes out of the delivery process. You want to make sure the baby is dried very well, and we assess and clear the respiratory tracts as well using the bulb syringe. We also want to educate the mother about using the bulb syringe and using the bulb syringe at the corner of the baby's mouth first before going into the nose to secrete any mucus or any blockages in the respiratory and the nasal tracts or passages. And we want to make sure that the vital signs are obtained and that the physical assessment is performed with the neonate within 24 hours of birth. Okay, thank you. I hope you liked my newborn. I didn't have any other bears.